So in our waiting room, we have a display of some products that some of the dispensaries have given us. They're not really any products, it's like olive oil inside of it, so nothing that's really too desirable, but it kind of gives an idea for a patient when they're talking about, do I smoke it, how do I smoke it, and I have to take a step back and say, no, in Florida, you don't smoke it. There's nothing that you need for a lighter, for butane combustion, but there's other options if you do want to smoke it. For example, you could use like a vape pen, and they come in a lot of different forms. They can be pretty innocuous, they can be charged with your USB cords or things like that, but the point of having a vape pen, and I actually do encourage most of my patients to use vape pens, is it's probably the fastest way to get your medicine. So for a patient that is having a panic attack and needs to kind of get himself or herself back to reality, a pen would be an excellent choice. Or for the patient who has chronic pain all the time but wants to go to the grocery store and now they're in excruciating pain just with little activity, something like a vape pen with a very fast, rapid action would be great as a breakthrough option. So it can work within minutes, and it may last like 2 to 3 hours. So it's not a long lasting benefit, and if that's your only source, you'd be using your vape pen multiple times a day. Some people don't have a problem with that. Other people would rather not, have the pen in public or things like that, so they would prefer something a little bit more long-acting. For long-acting options, you can do capsules, which the capsules you swallow, so it could take a little bit longer to get through your digestive tract, assuming that everything absorbs the right way. It could take 45 minutes to an hour. But then the other thing you have to think about is that when you're doing capsules or edibles, it still has to go through the liver, which means that it may be metabolized. And that can lead to different types of products. So I have some patients say, the same effect that I get from a vape pen, which goes straight into your bloodstream unadulterated, but then I eat an edible, and the edible kind of makes me feel just different. It's not the same effect. And that's probably because by the time it gets to the liver, it has already been changed in a structure maybe from 9-delta THC to 11-delta THC, and your body just may be responding to it differently. But some people do fine with it. Kind of an intermediate that I explained would be like doing tincture drops or oral sprays. So those are things that you would put underneath your tongue, hold it in there, wipe it around the cheeks of your mouth, and it works pretty quickly as well, maybe 15 minutes or less to kick in. Benefits could be maybe 6 hours compared to like a capsule could be 8 hours, maybe 12 hours for some people. So those are the options. I do like the drops because, again, you have most of it going unadulterated into your system. You're going to swallow half of it at the end of the day anyway, so it's kind of like I said, an intermediate between the two. Other options that a patient can choose is using lotions. So if someone has just very localized pain in their back, rheumatoid arthritis of their hands, which happens to be maybe a psoriatic arthritis, it really does good for psoriasis as well, using lotions. So there's options for topical. I have my children actually, some of the moms like using the topicals when it's an indica, and they'll put it on the children's feet to help them sleep because they're already using essential oils. Maybe they're already putting lavenders and doing things like that naturally to help them sleep. And this is just something that can complement their already kind of homeopathic remedies that they're using. And then there's the oral sprays, kind of the same kind of concept. What I don't have here, other options would be patches and suppositories and the edibles. From what I understand, edibles are kind of expensive right now, so most people, if they really want an edible, I just say use the drops, put it on some food, and then eat it. It's kind of an easier way to do that. That's kind of the really basic overview of the different modalities of the medicine.